Bismillahirrahmanirrahim. This will be a very tiny session. So, on an important topic, a favorite topic from this MRCP. Good evening, Dr. Rabab. Welcome. Welcome, all of you. So, now it will be a tiny session. I will take on tuberous sclerosis. Okay. Tuberous sclerosis is a very favorite topic for MRCP. Okay. For both part 1, part 2, even places. Okay. So, just I will take the important point that you need to remember for this tuberous sclerosis. Okay. First of all, Bismillahirrahmanirrahim. First of all, let me tell you that tuberous sclerosis, what is that? It's a genetic disease. Okay. Can anyone tell me, is this, what kind of genetic disease is this? Autosomal dominant or recessive or X-linked dominant or recessive? Any idea? Dominant, autosomal dominant. Very good. One of your question. So they can give vice versa. They will ask, maybe tuberous sclerosis, they will give you a scenario. They will ask you what kind of disease this is, autosomal dominant. Please switch off the videos, please. Or maybe they will ask you what is the autosomal dominant disease down there. Maybe they will give you some other disease's name with this tuberous sclerosis. So vice versa, you can get, but it is a favorite question from MRCP that will be regarded as a genetic question. Okay. Number two, you need to know about the chromosome that is responsible. Okay. There are two chromosomes actually that's responsible for tuberous sclerosis. Both of them you need to know. One is number 9. Another one is number 16. Okay. Please mute yourself. Somebody, I think it's not muted. Hope I have muted. Did I? Okay. So two chromosomes is there. One is 9, one is 16. Yes, Dr. Rubab, this session will be available for enrolled students. No problem. Enrolled doctor will get it, inshallah. This I will upload by tomorrow morning, inshallah. So this is the chromosome number 9 and 16. Again, important. Questions are coming from the chromosome number specifically. Then the gene loci, okay? The name of the genes, okay? This one is hamartine and this one is tuberine. Tuberous sclerosis, from here you can easily remember the name, right? It's almost similar with the name of tuberous. So tuberine, you can remember like that. Another one is hamartine, like hamartoma type of tumor it can have. So these two names also important, but most important, the number, the chromosome number 9 and 16. Okay, dear. And also along with this, I will tell you to remember the neurofibromatosis, another important topic of MRCP, to remember their chromosome number also, that one. So usually I'm remembering them together. So it will be easier. So you see 9, 16, after 16 it is coming 17 and 22. 17 it is neurofibromatosis type 1 and 22 it is neurofibromatosis type 2. This is just for interlinking to make your memory sharp regarding this is about neurofibromatosis. So anyway, I will remove that. So important thing I told you, this is an autosomal dominant disease. Number 2, the chromosome number. Number 3, the gene names. Now come regarding the features. Actually, for tuberous sclerosis, yes, Dr. Mina, for both part 1 and part 2, because I'm going to show you the image also now, okay? So there should be some neurocutaneous. So there should be some neurocutaneous feature. Neurocutaneous means from the name you can understand that there should be some dermal presentation, skin, and there should be some neurological presentation. Okay. So regarding the neurological presentation, you can remember DIE. What is DIE? DIE for there is developmental delay. Okay. I for their IQ level is low. Intellectually, they are getting low IQ. There is impairment. Okay. E for epilepsy. E for epilepsy. So these are neurological feature of this tuberous sclerosis. Finish. Now you will remember the cutaneous feature, right? Cutaneous feature, what you will remember? We have to remember cutaneous feature actually. So if it is a cutaneous feature, you have to remember 5 feature. You have to remember 5 feature. So I will give you the images and also the trick to remember it forever. Okay. Cutaneous means what? There will be something that you can see in the over your skin, right? So some feature you will get dark color. Just listen to me first. Some dermatological lesion, you will see that one is dark color. Some you will get light color, and somewhere skin will be thickened. So what did I tell? There will be dark color, there will be light color, there will be skin will be thick skin. So 3 type of thing you can get 1, 2, 3. Okay. Number 4 and 5, you will remember 2 tumor type thing. Okay. So if you touch your face or your cheeks with your hand finger, then these 2 are the places you will get some kind of tumor. Some kind of tumor. So again, some will be dark, some will be light. This is to remember for lifelong. And some you will get a thick skin. Okay. And some you will get in your face, some you will get in your fingers. So you can touch your face with your fingers. Okay. Now let me show you what are these cutaneous features. First of all, I told you some will be dark, right? What can be the dark one? Café au lait. These are known as café au lait. You know the café au lait, this is a French word actually. You know coffee? So from the name, you can understand it will be something like coffee color, brownish. So it could be light brown or dark brown, but it will be brownish and hyperpigmented. Okay, right? More pigmentation. So see, these are the, I was telling you to remember as a dark spot. So can you see that? This is the café au lait spot. Usually this type of spots are more common with our neurofibromatosis. That is another disease. But also in TS, tuberous sclerosis, you will get that. Finish our dark spot. Now I told you something will be light, right? Some light rash will be there also. Some light spot. See, these are my light spot. What are those light spots? These are like the leaf shape of an ash leaf. So see, there's shapes of these depigmented areas. These are like leaf shaped. So this one is the hypopigmented rash. Okay, so these are known as ash leaf spots. Ash leaf spots. So finish our dark spot, finish our light spot. Now come this spot, actually this ash leaf spot, you can see very good under your ultraviolet ray. That will give you the fluorescence effect. Okay, you don't need to remember up to that. Just remember the name, that there will be some ash leaf spot which are depigmented. There will be some café au lait spot which will be like brownish. It could be from light brown to dark brown. So we finish our dark and light. Now we will come, I told you there will be some thickened skin patches. See, chagrin patch. This one is known as the chagrin patch. If you can see from here, this is the thickened skin patch. This is usually, it is coming on the lower backside, usually in the lumbar area. So this thickened skin, it is known as the chagrin patch. So we finish number 1, number 2, number 3. Okay. So number 1, as I told you, this is café au lait. So this is actually, I was telling you that café au lait dark spot. This is your ash leaf. And this one is your chagrin patch. Finish. Finish. Even part 2 people, you will not forget, if because usually they are having the picture, right? Now come with, I told you, face and finger, some tumor will be there, small tumor. So let's see the tumor. Let's see the tumor so that you can remember. So in the face, just a minute, I need to see, there is butterfly-like, there is something, the distribution is a butterfly distribution, okay? But this is not acne. This is not a rash. This is like something like small papule. These are not only rash or not only redness. These are papule. Papule means there is like projection, right? Small projection. Actually, these are facial angiofibroma, one kind of tumor. Okay, so this is the name of this is adenoma sebaceum. So this adenoma sebaceum you will get in a butterfly distribution over the face. This is not acne. So finish our adenoma sebaceum. Number 2, I told you with the finger, touch your face, right? So this is the finger. In the finger, you will get some kind of this kind of tumor that is also fibromata. Okay, you can get it beneath the fingernail. Beneath means what? Under, right? Under, like this one, like the last picture. If you see, it is the under, so that is known as subungual. If it is the peripheral, like this one, this is periungual. So subungual or periungual, whatever you tell, that you will get the subungual or periungual fibromata. So this type of tumor you will get in case of cutaneous feature. Is it clear? Tell me the cutaneous and neurological feature. Is it clear? They will mention 2-3 features from here and they will ask you what is the diagnosis. So if you miss 1 or 2 or if you don't remember, then you cannot diagnose that, right? Okay. Now come, this is important, this 5 feature from cutaneous and 3 feature from neuro. If you can remember this 8 feature, you finish your tuberous sclerosis. That's it. Okay. Some extra tumors are also there. So let me show you some other organ of the body. They can have some kind of tumor also. So what can be those? In the eyes, there can be retinal hematoma. Hematine, I told you, the 9-number chromosome containing hematine, the hematoma, okay? So retina, you can get this retinal hematoma. As you can see, there is the white area. This is dense white area. Another name is known as phacomata. Important for part 2 people. Okay, this is the phacomata. If they are giving this, along with that, they tell you just the history of epilepsy. Definitely, it is your tuberous sclerosis. So you need to identify this retinal hematoma from the picture. This is for part 2 people only. Part 1 people, you need to know the name, retinal hematoma or phacomata. That's it, okay? So for this extra feature, you can remember actually 3R with 1L. What is the 3R? 1, retinal hematoma, I just told you. 2, in the heart, you will get rhabdomyoma, like this. They have shown here. Okay, rhabdomyoma. Then the other R is there will be also in the renal some tumor will be there in the renal. So what is this? Renal angiomyolipomata. Renal angiomyolipomata. One question came from here for part 1. Renal, what you will get? Which type of tumor? Important. Okay. So this number 3R is renal angiolipomata, myolipomata. Okay, dear. This is the 3 organ. Also, there are sometimes polycystic kidney you can get. So that if you remember this picture, you can understand. One another question, it came, I think, in 2022 or 23, part 1. They asked about this lung tumor of tuberous sclerosis. This is also important. So they have a question. What type of cystic lesion you can get in tuberous sclerosis? There are multiple lung cysts, and that one is known as LLMM, lymphangioleo, LLMM, myomatosis, lymphangioleo, myomatosis. It's a big name. That's how I like to remember at my time. So lymphangioleo, myomatosis. There will be multiple cysts in the lungs. Okay, dear. So these are the extra feature that you can have. For part 2 people, this is important, this retinal. For part 1 people, this kidney tumor and this lung tumor, these two names are important. Okay, they will ask which is associated with tuberous sclerosis. That's it. That's it. You don't need to know about the treatment or anything. Okay, nothing, no questions are coming from this. Just tuberous sclerosis, the genetic, this is autosomal dominant, number of the chromosome, name of the gene loci, and the features. Features, neural features, dermal feature, and this extra feature. Neuronal feature, dermal feature, and this extra feature of this picture. That's it. You finish your tuberous sclerosis. Okay. Any question? I'm going to finish this session. Any question?
No, ma'am.
Okay. Thank you. Thank you. So I'm sorry, I need to finish this because I have to start my endocrinology another class. Thank you so much, everyone, for attending the session. Thank you. Allah Hafiz.